It's 12 o'clock. I'd like to welcome you all to the Foley Institute. Thank you for coming along today. This is probably going to be our last event on the year, so we'll be starting up again in the fall with something really interesting on the future of liberal democracy. So I hope you do join us for that. But right now, it gives me a great deal of pleasure to introduce today's speaker. Noel Vest is an assistant professor at Boston University School of Public Health. Dr. Vest is a formerly incarcerated scholar who advocates for social justice issues and public policy concerning substance use disorder recovery and prison reentry. His research interests include mental health, substance use disorders, poverty, social justice, addiction recovery, and pain. That's a lot of stuff you got. A lot of stuff. He was recently awarded a KO1, is that how it's KO1 Early Investigator Award through the National Institute of Drug Abuse to study collegiate recovery programs through an implementation science lens. He recently finished a postdoc at Stanford University, and prior to that, he received his Ph.D. in experimental psychology here at WSU. Go Cougs! And I do have to say that is one of my best memories of Noel. We were standing in line next to each other as we both received our PhDs here, so very nice to see him back there. And so please do it.
Yeah, I won't be able to stop smiling this entire presentation. It is an absolute honor to be here, and just thank you, Richard. Thanks, Cornell. I know he's not here today, but thanks, Cornell, and everyone here at Foley and at WSU. It truly is an honor to be here today. So I first kind of want to set the table and add some context to kind of my interest in the fentanyl crisis as it applies to institutions of higher education. There's kind of like a backstory. And so I'm going to weave a little bit of my kind of a brief history of my journey, not just to WSU, but to Stanford and to Boston University as well, and hopefully come up with some kind of outline to some of the work that I've been involved with in this area. So, like I say, kind of adding some context. I always like to start out with a thanks to both my family and my wife. They've been an incredible support, not just here at WSU, but an incredible support really this entire academic journey. And so definitely would not be here without them as well. Really quick funding disclosure. As Richard mentioned, I have a NIDA KO1 to study collegiate recovery programs. I also serve on the board of directors for a nonprofit in Seattle called Civil Survival, but no conflicts of interest to report. So this is not my first rodeo with the Foley Institute. So I was here in 2018. I came through and presented with a group of scholars, all of us having been formerly incarcerated. And so we presented on this idea of higher education after prison. So if it's not evident from this slide, the next slide will make it very evident that I am someone that was justice involved before coming into a higher education journey. I think that for me, prison was definitely a kind of a blessing and a curse in that it was obviously a time for self-reflection, but it was a place where two things kind of happened for me. I entered into long-term recovery from substance use disorder, and then I also started a college and prison program, which really kind of instilled some things in myself that I just didn't know were possible. And so when I was released in 2009, I spent the next 12 years kind of traversing the road of higher education in spite of some of the multitude of the collateral consequences really that come with that. And so the journey started at CBC in Pasco, Washington, and then it continued on to WSU Tri-Cities, and then next it continued on to Washington State University here in Pullman. This is a great picture because this is my very first day of my PhD program. As soon as I got off the bus, I took a picture just right down the hill here, and so I think it's just a wonderful picture to kind of rekindle that great period of my life. And so in 2014, at 43 years of age, I started a Ph.D. program here at Washington State University. While I was here, a couple of the things that I'm kind of most proud of, I helped to pass legislation with help from people here at Foley and Chris, the gentleman that is the kind of the liaison to the Washington legislature, and Arlen Harris. I helped to pass legislation that removed the criminal history boxes from all college applications here in the state of Washington. And then also while I was here, I helped to found a collegiate recovery program here with a gentleman named John Wallace, and Patricia Mearhouse was our faculty sponsor of that program. But as with many good things, all good things must come to an end. And so I finished my PhD here in 2019, and from here went on to a postdoc at Stanford University in the School of Medicine, and in particularly in the Department of Pain Medicine. And so this is where things kind of start to kind of interweave with this what I'm going to present here today. The other thing that I'm really I like to point out with this slide is that I think WSU was definitely a place that I became comfortable, I think, kind of sharing about my histories with both addiction and with the criminal justice system. But this was the first job that I actually this is the first instance where I was kind of specifically chosen for a job, really based on my unique journey to higher education. And so, and this is where I really start to learn about fentanyl on college campuses. Before this, I had never really even, I had heard that fentanyl was kind of an East Coast problem, but it really didn't come on my radar until the year 2020. And I don't know if people here remember, but there was a student here, a football player here at WSU, that died of an accidental fentanyl overdose. So this is my first experience, kind of understanding, that fentanyl use is kind of happening on college campuses. And I was, really, really extremely lucky to be in a lab at Stanford that was already kind of seeing the writing on the wall in this area. And so up until this point, I think fentanyl was really thought to be just a problem with drug supplies, primarily on the East Coast at the time. And so I worked with my lab mate at Stanford, her name was Chelsea Shover, to really kind of document. So what happens with the CDC data is usually comes out 1 or 2 years too late, because it usually is just not a good descriptor of the current drug supply issues. And so what we decided to do was to look at, rather than rely on CDC data, we took coroner data from different counties across the country, or at least east of the Mississippi, or west of the Mississippi, and looked at current amounts of death. And so we were the first to report that the fentanyl crisis is really quickly and rapidly moving across from East Coast to West. And this is likely not, by the time we see the next CDC data, this is not going to be just an East Coast problem. It's going to be a West Coast problem as well. And then this really starts to hit home. So there was a student in a fraternity at Stanford University that died of an accidental fentanyl overdose. And this was, obviously very, very devastating on campus. This was right before COVID. And so it really kind of, I would say, kind of shook up the campus, and definitely got me a lot more interested in this topic. And a couple of things just kind of happened, I think, intrinsically with this happening that really allowed me to kind of get a little bit more involved front and center. And so these are students at Stanford, Max Moss and Nicole Takia. And these two students were very good friends with Etienne, which was the student that died. And they were very, very upset, obviously, as you can imagine, about losing their friend on campus. And I think more importantly, they felt it didn't seem like Stanford was doing enough around this issue. And so they really kind of set out to do more. And so they really wanted to kind of make an impact in this area and get Stanford on board with making some policy changes that were going to impact future kind of generations of students coming to Stanford. And so these two students reached out to me and asked me if I'd be willing to mentor their efforts. And I told them at the time that I would absolutely be honored to help them. And so really, I won't go into a lot of detail around like exactly what we did, but the work that they did, the end result was that Stanford really did start to take notice. They started offering Narcan trainings around campus, and today now they have in every housing unit they have these fentanyl test strip kits and Narcan boxes in all of their housing units. And this is from, again, just two students that really wanted to make an impact across their campus. Today, Nicole is an incredible medical student at Stanford, and Max is the same at Brown. But again, this had a lasting impact on me, just kind of seeing how student level advocacy could result in some of these policy changes. And it wasn't just at Stanford that it was having this. The other thing that I'll talk about before I get onto the state level is that this had a lasting impact on myself too. So my wife and I were recruited because of our recovery status to be the inaugural resident fellows at the substance-free housing unit at Stanford, which is about 30 to 40% college students in recovery. And so we lived on campus with these 51 undergraduate students, and it was the first house to have Narcan available to all student staff. And then we also held weekly Narcan meetings like in the student, we have like a little open area within the house. And so we just decided that we're gonna hold weekly trainings there. The next year, it was mandatory for all student staff in every housing unit, and that was the boxes that you saw there were implemented to all housing units. And so again, this was all based on the work that Nicole and Max had done. And then the lasting result was that they had an impact on state legislature as well. And so this led to some of the work that they did early on, led to Senate Bill 367, which is known as the Campus Opioid Safety Act. And really from this point forward, I would say kind of in my career, I really became very, very interested in not just like advocacy around this, but also around research in this area as well. And so while all of this stuff is happening, I'm applying to different positions at different universities across the country. And then Riley and I finally decided that we were going to make the cross-country move from Stanford in 2023 to Boston University in the School of Public Health there. And so I'll kind of just, the rest of this is going to be really some of the research work that I've done in this area. And so the great thing about becoming an assistant professor is that you get to work with really, really awesome students. And so I was definitely no different in this area. I worked with the first person that I got to work with on my first dissertation committee is this incredible scholar right here. Her name is Christina Freibot. She's a Ph.D. graduate student in health policy and law department at the BU School of Public Health. And she came in really wanting to understand opioid overdose and naloxone distribution within college settings. We are one of the sites for Boston University and University of Michigan are one of the kind of the hubs for what's known as the Healthy Minds data. And so it's just a large data set that is collected at colleges kind of across the country. And so she is definitely my collaborative partner. Being on the dissertation committee is great because she gets to do all the hard work, and I just got to kind of sit back and oversee the project. All right. So how did we get here, and what is kind of the next stages as far as what we want to do? So I don't think that this slide will be super probably a shock to anybody in here, and I would guess that many people have probably seen this slide before. But the way that the narrative around the overdose crisis or the opioid crisis in this country has been framed is that there are kind of four waves of the crisis, right? So the first one began with naloxone, or with prescribing prescription opioids in kind of the late 90s and early 2000s. We saw a large increase in overdose deaths. And then the second wave, once they started kind of restricting access to prescription opioids through PDMP programs and things like that, you saw kind of the second wave of the crisis begin in 2010 with a rapid increase in overdose deaths among heroin, or as attributed to heroin. And you saw this fivefold increase from 2010 to 2016. And then the third wave has been significant increases in overdose deaths involving synthetic opioids, so primarily fentanyl. And then what is known as, and again, this is, I think, a little bit still unfolding, as kind of this fourth wave, which is kind of a co-use with stimulants, so either cocaine or methamphetamine, kind of an opioid and psychostimulant phase of the crisis that we're going through at this point. Regardless, there have been over 1 million overdose deaths since the year 2000, and one of the populations I think that is probably most important, because a lot of people start experimenting and using drugs and alcohol at right around the college age is very much a time, or adolescence and young adulthood is definitely a time and a demographic of particular concern for the opioid crisis because of the potentially compounding effects of opioid misuse kind of early in the lifespan, and then regardless, this population is definitely a population that we become very interested in, and I think primarily because despite we've seen kind of a slight reduction of opioid overdose deaths in the last year or two, but that's not true for young adults. And so while it's reduced among other age populations, you've actually seen an increase in adolescents and young adults. I think that even more concerning is that fentanyl is being contaminated in non-opioid drugs, and especially contaminated with in pressed pills. And so, despite the increase in overdose fatalities among adolescents and young adults, there really is very limited public health research, at least at the national level, in this area. And so you can't really, I don't think, understand adolescents and young adults without understanding that a large portion of adolescents and young adults are in higher education or enrolled in colleges and universities. And so there are more than 20 million adolescents and young adults enrolled in universities. Many schools have existing public health focused programs such as bystander sexual intervention, suicide prevention, substance use disorder education programs that really makes it an ideal kind of setting to employ kind of upstream prevention strategies for opioid misuse. I think it's no secret that these programs can really kind of vary in their content and methods, but they share kind of this common goal of preventing a multitude of short-term and long-term negative outcomes and improving the well-being of adolescents and young adults within this college setting. And that just, again, kind of lays the table or kind of sets the table for what we'll talk about kind of moving forward now, which is kind of the impact or what we're seeing happening on college campuses. And so what we're seeing is many times accidental overdoses. And so just kind of dating back to 2020, where, you know, the first one that I had kind of become, or the one that had kind of presented itself in kind of in my world, you also saw a huge, or not a huge increase, but you also saw over the last 4 years a lot of overdose deaths. Sometimes a contaminated batch of pills were happening, and so sometimes you would see 2 and 3 students die kind of at the same time. And hitting home, there was a student death at Western Washington University in 2024, and with these overdose deaths come along with them kind of multi-million-dollar lawsuits against the university for not doing enough to prevent these deaths. And so you'll see media coverage that looks like this, and I think the negative media fallout negatively impacts universities. These lawsuits follow, and a lot of times what they'll do when they have these insurance payouts or when the insurance pays out these lawsuits for these universities, the language in the lawsuits kind of force schools to implement these changes. And so I think as a result, I think you have kind of these forward-thinking states which own many of these universities, obviously the public ones, that are now trying to kind of front load with strategies around how to save money, but also investing in strategies to reduce overdose deaths. And so I'll kind of talk briefly about the state of Washington here, because they are one of 7 states that, and again, these are, so this is just a scan of laws up until not this current legislative session. So this is as of the 2024 legislative session in states across the country. There are 7 states that have passed some type of legislation relating to overdose education and access to opioid agonists such as Narcan, which we all know is a kind of an FDA-approved medication that can reduce an overdose. These laws vary very much in scope and content, with some of them kind of requiring access to these opioid antagonists, while other ones mandate training for faculty and staff and students. And again, this is just an example of the kind of some of the wording for HB 212 here in Washington, and I'll talk a little bit more about this a little bit later in the presentation. Okay, so this presentation is going to focus on kind of 3 different research projects. So the first one was, working with Christina, we really wanted to understand what's out there in the literature, right? What currently exists in the literature, because there really haven't been, up to that point, there hadn't really been any systematic reviews, and the research was kind of all over the place. So we wanted to understand, what is the current snapshot of what the literature looks like. And so we decided that the first step in this was going to be to write a PRISMA-guided scoping review on OED, or opioid overdose and naloxone distribution within the higher education setting. As far as a model or a framework that we worked from within college settings, I think one of the frameworks that kind of set itself up for understanding how to categorize these papers or how to kind of categorize what's out there in the research was this substance use disorder continuum of care. And so SAMHSA uses this quite a bit. There's a lot of research that uses this, but this idea that, you know, you have on one end of the continuum of care kind of prevention, the next you would have early interventions or identification of maybe problem use or maybe substance use disorders. Then you have treatment, and then you have recovery support services. So this is how we tried to categorize the papers that we ended up finding in this area. And so first and foremost, I would say that there's not a whole lot of research out there. We only found 46 peer-reviewed articles. And then these are the breakdowns by each continuum of care domain. And so we broke it up into, there was 26 articles for the prevention side of things. There were 10 articles in kind of early identification of problem use. There was 6 articles related to treatment, and then there was 2 articles related to recovery. And again, when we talk about kind of a broad swath of research, this is not a heavily researched area, especially among young adults. And so the main findings of this included that we needed to develop campaigns that emphasize that just a single use could potentially be very, very dangerous to address kind of misperceptions of peer use. Contaminated pills were kind of primarily, I would say, kind of responsible for many of the deaths on campus, because if you look at actual rates of opioid use disorder, they're fairly low on college campuses, you know, compared to alcohol and cannabis and some of the other substances that are used on campus. And it kind of became clear that within these papers that a very common approach or one that was emphasized was that it would be a good idea to maybe have these Narcan or Naloxone kits where they would have other emergency types of kits. So, you know, AEDs and kind of, you know, grouping it together with these emergency responses. Another thing that was talked about, especially in the papers around treatment, was that buprenorphine should definitely be available for college students within student health services, and that both medications for opioid use disorder and kind of 12-step or any kind of recovery-based mutual help meeting should be available as well. So this was the kind of the first step that we took in this line of research. And again, it just really kind of showed us that there was just a lot of work to be done in this area. This is the second part of this study, or second part of the research that we were involved with. So we wanted to create this policy tracking database. So to further kind of understand this landscape of higher education, we wanted to look for the presence or absence of these opioid related policies. And so with the Healthy Minds survey, all of the schools put in their strategies for the coming year as part of that. And so we downloaded every single strategy that existed in all of the Healthy Minds colleges, and then we scanned those for different kinds of policies. So the policies that we looked for was, does the school have a Good Samaritan policy or a medical amnesty policy? Do they have overdose prevention types of activities on campus? Do they offer substance use disorder treatment? And then do they offer naloxone training? And so this is what the scan looked like. You can see that we kind of had do we just put zeros and ones in for all of the schools that had these different policies? And we had obviously a super long list of colleges within that Healthy Minds data. And so what we found was that 51% of these schools had some kind of either Good Samaritan or medical amnesty policy. So if you're reporting an overdose, the person that's reporting it is not going to get in trouble legally for doing that. 27% described options for substance use disorder treatment within their coming year's policy. 22% had Naloxone that was available somewhere on campus. 18% offered Naloxone training, and 16% had opioid overdose prevention programs. Importantly, there were only less than 7% of these schools had all 5 of these categories. The next thing that we wanted to understand was we wanted to understand knowledge around opioid use. And so to kind of get a snapshot of current students' understanding of opioid knowledge on campus, we added questions to the Healthy Minds survey. They have kind of a huge national survey that there are about 90,000 students that fill out this survey. So they have the main survey, but then they also have a substance use disorder like module for it. And so we added questions to that substance use disorder module to see what we could glean about people's understanding of opioid overdose on campus. And so this was done in 2021-22, and we added these 4 new questions. I know that they're very, very hard to see, but it was really, the questions were about naloxone knowledge, being able to identify an overdose, so recognition of an overdose, naloxone use on campus, and then was the person willing to intervene? And what we found that was that 14.2%, and again, I think this is kind of the take-home message of this, is that only 14.2%, so under 15% of students knew how to administer naloxone if they needed to. We also found that 30% could correctly identify naloxone use. 62% could correctly identify at least one sign of an overdose, and that about 67% felt comfortable calling emergency services. And so this paper was published in JAMA Pediatrics, and again, I think they really emphasized, and there was a lot of coverage around this, that only less than 15% knew how to use naloxone, and it really was kind of at least for us, a call to action in this area. There were also differences, I won't get into them here, but there were definitely differences between sex and age and race that were very important as well. So while this was kind of a really important first step in understanding like these base levels of knowledge, it was really hard to kind of inform policy. And so we really wanted to kind of take this to the next level. And so the next part, or the last part of this area of research, is that we wanted to do a qualitative project where we asked about so substance use. So very similar to at these universities, very similar to a position like Patricia's here at WSU. We really wanted to understand, at this administration level, what was kind of getting in the way of these of implementing these kinds of policies. And so we did a qualitative project where we looked at 25 schools. So this is the original sample of the Healthy Minds survey right here. So this is all of the schools across the country that they're involved with. We wanted to break it down into schools that were that had an opioid policy and didn't have an opioid policy. And so we kind of restricted it a little bit further. We sent out invitations to all of these schools to be a part of that of this qualitative finding, and we received word back from about 25 of these schools. And so we held 25 interviews. 14 of the interviews were at schools with opioid policies, and 11 were at schools without opioid policies. So we get kind of the full gamut of understanding. Obviously, you can tell that in the final, geographically, this, you had about 12 institutions in the South, 5 in the Northeast, and 4 in the Midwest, and then 4 on the West Coast. So we felt like we had a pretty good swath across the country and kind of trying to understand this. And so, again, pretty good geographical representation. This was again, I won't get into some of the details of it, but this is kind of a for the first part of our implementation science focused study around this. And so we kind of boiled this down into 4 themes. So the first theme was this idea of kind of shifting the narrative around opioid misuse and overdose to hopefully try and broaden support for research. And so within this theme, I would say that participants kind of described the notion that opioid misuse and overdose was really not perceived as a problem at their institution. And this was particularly evident with administrators. And so they felt that kind of a lack of student level data suggesting that there was like this meaningful percentage of students that misuse opioids, that it often kind of raised questions about how they should allocate resources and the necessity of investing in Naloxone when they have a lot of other things that they need to invest in across the campus. But we did find that kind of this talk around kind of like reframing the conception of opioid misuse to poisonings, right? Because that's really what's happening here, or where you have kind of these one-time or infrequent uses of non-opioid substances, which have been contaminated with fentanyl. That definitely kind of caught the eye I would say it increased administration buy-in in those situations. For the next theme, participants described what we found were to be kind of these internal and external advocates for implementation. And so in this theme, they kind of described partnering with many different campus organizations, including student organizations, so Greek life, health-related, LGBTQI centers, faculty, athletic departments. And then they also described some policies that required kind of school-level action, or and that they felt like made implementation easier. So similar to what we talked about earlier, kind of these state-level policies where states kind of are mandating fentanyl test strips, or are considering, or mandating fentanyl test strips and then Naloxone distribution. And then on the flip side of that, in states where fentanyl test strips were illegal, it really made it difficult to, it restricted the education that they could do because the subjects kind of considered it a really kind of these divisive concepts. And so lastly, participants described part of the community at large as the driver for implementation, and that college campuses don't exist in a vacuum, but instead are part of a broader community for which these resources tend to be very, very beneficial. The third theme was around collaboration. And within this theme, the participants described several within campus partnerships that helped kind of spread the word or spread awareness of existing resources, and it really kind of alleviated that burden of delivering the programming for themselves. And then many participants described learning about other schools' approaches through like professional networks, and that really helped going to conferences and really kind of understanding what other schools are doing and how they're kind of tackling this problem moving forward. And then the last theme it really kind of revolved around this very like breadth and depth in approaches to overdose prevention. And so schools, a lot of times without internal funding or support, would partner with outside organizations, so county level departments of public health, and they would kind of expand their own capacity doing that this way. This theme really, if I was going to like put a finger on what this was it was really about like, how do we do this when we're operating on a shoestring budget, when we don't have the resources to do this? How can we still be effective? The one thing that I would also say, and I find this to be important, and I know that people in this room will relate to this, across themes, was this notion that you needed buy-in from stakeholders at every level. You needed student level buy-in, you needed faculty level buy-in, you needed staff level buy-in, you needed community health level buy-in, and you need, I think most importantly, administration buy-in as well. And so this was the project that Christina did, and like all good things, Christina went from graduate student to Dr. Freebot and moved on. But I am happy to report that Dr. Freebot has actually accepted a position in my lab and is going to be, we're going to be continuing this work as we move forward. And so I'm incredibly excited. We're going to work on a grant to do this. So she's coming back again, and I'm really excited about that. As far as a snapshot for kind of what we took away from this study, within that scoping review, you know, the thing that we noticed the most was that a majority of these existing studies focused on prevention. So I think understanding, you know, this across the continuum of care will be a kind of a focus moving forward. A lot of times it was just done at one university or a single institution, kind of using cross-sectional surveys. And so I think obviously the next stage of that will be doing some RCTs and really trying to find out what implementation strategies are going to work the best for introducing this at colleges. Nearly 2/3 of college students are willing to intervene in an overdose, which is, I think, really great news, despite not, you know, low opioid related knowledge. And then lastly, this phased implementation and ongoing adaptation of OEND, overdose prevention, overdose education, and naloxone distribution is going to be key to kind of overcoming these barriers. And so what's next in this area? I think you don't have to travel too far. I think one of the states that's leading this is actually the state that you live in right now. Last year, Governor Inslee signed the HB 212. And so I think that is can be a huge help for schools and for states as a little bit of a snapshot as to what HB 212 mandates. A lot of the things that we just kind of talked about within higher education institutions, which is great. So access to naloxone, training of staff, training of students, availability, making available fentanyl test strips, those kinds of things that we know are very important for reducing overdose, not just on campus, but reducing overdose within the general population as well. I think one of the great things that Patricia and her team here at WSU are doing is these naloxone trainings, or OEND trainings, and they have these basically, when I looked at the website, like every week or every other week in person, and so incredible work being done by Patricia and her team. And I believe we have some pamphlets over here for anyone that is interested in learning more about that here on campus. So I think this is exactly what we need kind of across the country. And so the next steps for me is working with Christina to write hopefully a large NIDA grant to understand, based on those barriers that we identified, identify some implementation strategies that we can now take and test to see which of these implementation strategies are going to kind of be the most effective across this university or across kind of all universities. And so an implementation science focused grant to study the uptake or increase the uptake of overdose education and naloxone distribution. And with that, I am done with my slides and can definitely open it up to to questions.
So we've got almost 15 minutes for questions now, if anyone would like to jump in.
Stanford was perhaps one of the ones that was furthest along. Were you able to see how many?
Possible, well, it really truly is impossible to know, because that was what we thought too, right? We can just study CDC data at in one of these states that have passed these laws, but it's impossible to understand how many students are dying because it's not something that's recorded. They just do all adolescents and young adults. So the data part of it is really, really hard to get at that particular outcome. I think what it is possible, and again, there are so many issues to this, but what could be possible would really be to look at the number of, and again, they don't like to release this information because they like to keep it quiet. They don't want it to be known, like how much they're paying out in these opioid settlements. But you could kind of look at opioid settlements that are being paid out by states and by institutions, and trying to understand it from that perspective. Things that we would be interested, I think, are the same things that these OEND implementation projects that happen within all kinds of different populations. We would be looking at uptake of like education. We would be looking at uptake of how many naloxone things are being distributed. But to get right at your question, I think that would be very hard data to collect. Not that it would be impossible, but I think it would be really hard to get at.
Maybe emergency responders to campus or survey of students.
Could
Have
be.
you participated in?
Yeah, and they do record that. They do record how many trips to the ER are recorded, and they, I think, look at arrests, I believe, as well. But that's one thing that could potentially be looked at. And so, all of this is on the table, I think, for the next stage of this work. But and thinking inventively about ways to kind of get specifically at that data for sure.
I have a lapse of logic here. Okay, why do some prescription opioids get laced with fentanyl? What's the motive for that? And is there money being made doing that? Is it, I don't understand that particular part, that where a single pill is poisoning you, and it's a prescription drug.
Yeah, so I think that there are a couple of people doing research in this area, and I think that there are probably a couple of different things going on. I think that people that deal drugs tend to like separate all of their drugs probably on like one surface, and potentially contamination is happening that way. So that's one area of like, you're putting these pills together, and you can get and because fentanyl is just, you have even a very, very small amount of it, and it's very, very potent. And so I think part of it is that potentially. The other thing too is that, so, and again, I don't have like a percentage to tell you, but it seems like a lot of the news articles that I've read, these are actually pressed pills that are causing these overdoses on college campuses more often than not. And so people are taking them thinking that they're ecstasy, but the pressed pill is actually some, and I think, and again, I don't know exactly if this is what's going on or not, but it could be contaminated in that, it's like a happy medium, right? You want something in there that may be a little bit more addictive than the main drug, or you want something where someone's going to kind of feel the effect of something that's a lot cheaper to get in fentanyl than it would be, going out and buying a whole lot of ecstasy or something like that. And so that could be part of it. I honestly, I don't know, but those are tend to be the two lines of thought in how these things are kind of becoming contaminated. I mean, as a business model, obviously, it doesn't make sense to have a whole lot of fentanyl that's going to be killing people. So I don't think there are drug dealers out there that are like specifically saying like we're trying to or they wouldn't even be saying that. But I don't think it's a purposeful type of thing. I think a lot of time it really truly is some kind of contamination. I don't think it's been being added to this most of the time purposefully. Good question though.
I have a quick question about I like the fact you had a good spread of schools for your survey, for collecting your data. And I'm wondering if you found any differences, whether it's geographical, political context, about areas or schools that were better or worse, and if you could draw any conclusions for, based on some similarities about places that are more effective. So places like Washington, which is maybe more effective doing this, or maybe other places where really there isn't the political will, or there's some other reason. Maybe it's because it's in a more rural area that they're less willing or less able or have less funding. If you found any conclusions like that.
So I can't speak directly to that. I think that there's definitely truth to that, just in general. What I can say is that if you look at and I didn't bring the data with me today, but if you look at, there are 176 collegiate recovery programs kind of across the country. The most are actually in North Carolina and in Texas, and then followed by California. And so, the schools that are out there kind of providing these resources and I think advocating for these resources really are kind of across the board. I think the Midwest is definitely an area that we're seeing, there are no collegiate recovery programs, there are nobody kind of doing this work I know the state of Missouri, they have their own database that they collect, the MOCB data, and so I've been involved with some of the individuals there that are collecting that data, and they're trying to kind of get at the same thing that you're asking. That's all to say that everything that you just mentioned, that is basically the next grant that we're really trying to write, because we do want to understand, are these states that have implemented these changes, are we seeing, reductions in overdose? Are we seeing, changes within these states? And so I think that is a really important thing. We'll also probably look at rural versus urban and a couple of those kinds of things. And I would say that especially these kinds of interventions tend to be just a little bit more without state level intervention. They tend to be things that kind of happen in urban areas first. And so you'll see a lot of resources and people get comfortable with these kinds of resources in urban areas the way that they don't really do in rural areas until they're kind of brought up to speed, or unless they have something happen on campus, or unless there's state level interventions that mandate it.
So I have a question. So the last about 10 years, I and others have been trying to put overdose prevention a little more centered and do what we're doing now. But we really couldn't get a toehold with upper administration, anything out of just absolute basics within the student health services until, I hate to put it this way, their hand was forced by legislation. And I think even with all the statistics you provided, that would still be the case if the legislation wasn't there. So policy and legislation really important. So my question is, I don't know if you have the data now or you're gonna go get it, but what does that look like? You cited recovery, schools that have recovery programs as being a little more forward. What about states with very specific legislation or health policy be kind of forcing higher education institutions to implement? What have you done there? Or are you gonna go get that data?
Yeah, so I think, I mean, it just goes exactly to what we, I think the entire time here, right, we're knocking on doors of, administrators, and, obviously I realize that all of them are very busy and have other priorities that are going on. And a lot of times this falls kind of to the wayside of those priorities, but it almost felt like every time we left an administrator's office, it was like they were shaking their head yes in front of our face, but then kind of shooting us in the foot as we're walking out the door. And so I realized that it doesn't just take kind of advocating for yourself at these administrative levels. It does take, and so that's why we worked on, meeting with Lauren Davis and adding that money around collegiate recovery, because we know that's such an important. And so I think it's, I think it's very, very important. It's like a two-pronged attack to it. It's not just, the perfect world is when you have an administrator that maybe comes from a different university or is really, really involved in these types of programs. The gold, I would say the most important or the best way to implement some of this stuff is to have an administrator that's in recovery and has done work around these areas. That's where, the places like Texas Tech, the places like, these other universities that have these incredible $40 million endowments around their addiction recovery services, that's how they've been very, very successful. And so I don't know if I'm answering your question, but really is a two-pronged approach: the research side of things, the advocacy side of things, and then really making sure that administrators are not just, holding them to their word, not just having them shake their head yes as you're walking out the door, but also following up and having them live up to whatever they're saying.
So we're seeing that in like Illinois, obviously California and the like. Are you seeing a trend toward more and more legislation to force that?
It's really comes down to these lawsuits. It's where I see people, the states becoming much more involved. They don't think opioid use is and it goes really to that first theme that I talked about. They just don't see it as being a problem on their campus, right? That NIMBY kind of a thing, not in my backyard, kind of like, oh, this doesn't happen on our campus. We're a closed campus, or we don't allow drugs and alcohol at all on our campus. That's kind of short-sighted viewpoint. That really, I think leads to, and then, like I say, and then they're confronted with a death. Ohio State University was a great example of that. They had 3 people die in 1 week, and were absolutely forced to kind of reckon with some of these issues. So a lot of times it does have to do with these deaths.
Well, unfortunately, we are out of time. It does seem a little, both sad, but I guess helpful that it takes a lawsuit to make legislation change. But please join me in thanking Dr. Vest for a great talk.
Thank you. That's great.